reason to access a secure records room. And we could get into all sorts of questions about why the implantable microchip is a terrible idea for security, but I will leave that to you to go to antichips.com for that information in our FAQ. So as far as implanting human beings with microchips, could they cause cancer? Well, we do know that any foreign body or any foreign material implanted into a human being has the potential to lead to cancer. Humans are less susceptible to developing cancer from foreign bodies than are mice or rats. Mice or rats are actually quite susceptible, and the 1 to 10% is probably way more than we'd be likely to see in human beings or even in dogs. The reason mice and rats are used for this kind of research is because they do have a higher likelihood of developing cancer, but the reason they're used in cancer research and in toxicology research is because they give you an indication as to what sorts of things may lead to a smaller percentage of human beings developing cancer. So I would say, and along with many of the researchers, which Todd Lewin from the Associated Press ran this past, cancer experts who work on human cancer research, they have all pretty much universally said that this would be a serious cause for alarm, that these animals were developing cancer. All right, when our study came out, and in our FAQ document, we have a whole section on lies that have been told by the RFID industry, and it's been really kind of an interesting experience watching them spin the story. One of the articles that came out in Time magazine was actually written by Scott Silverman, the CEO of the Verichip Corporation, and I would encourage you to take a look at that in our FAQ document, because it was really just an extraordinary piece of propaganda and full of inaccuracies. And I'm going to address just a couple of these here in case you may have heard some of these. I'd like to dispel these myths. The first thing that the Verichip Corporation said is that these studies were conducted in animals that were prone to developing cancer. Well, in 5 out of 6 of the studies where mice and rats developed cancer, they were using standard Sprague-Dawley and other types of standard laboratory animals. These animals are used because they're hardy and because they're actually resistant to developing spontaneous tumors. That's why they're used in toxicology studies, so that when they develop a tumor, you know that it's probably a result of what they've been exposed to. One of the animals, and I'll get to that in a moment. All right, one of the animals in 1 out of the 6 studies, the animals were genetically modified. This is the P53 mouse, which is modified to lack a portion of one of its genomes. That makes it more susceptible to a very specific type of cancer, which is in response to exposure to genotoxins. Now, these mice are, again, selected specifically because they do not develop cancer spontaneously. They only develop cancer in response to exposure to a genotoxin. And these mice had the highest rate of exposure. 10.2% of these mice developed cancers around the microchip. So that gives very, very strong, I think, cause for concern that if these particular mice, which before the age of 6 months hardly ever develop spontaneous tumors, we see 10% of them getting tumors, that would indicate that maybe that hypothesis about the genotoxic attributes of the microchip may be accurate. Now, one of the questions that's been raised about this research is that the researchers who reported on this over that 16-year period had not set out specifically to look at the safety of implantable microchips. They were actually doing other studies. They had taken these thousands of mice or thousands of rats and injected them with microchips as a way to identify them, to separate them into a control and an experimental group while they experimented with other compounds and chemicals. What was surprising to them was that even the animals that had not been exposed to those chemicals, the control animals, were developing cancer at about the same rate as the animals who had been exposed to the toxins. So the fact that control animals whose only exposure to anything was the microchip implant were developing these cancers was enough cause for concern for these researchers to take time out from the other work that they were doing and dive into this particular research. Now, my guess, this is probably happening in laboratories all over the world. If it was happening in these particular cases, these are studies out of Bayer, B-A-Y-E-R, the aspirin, big pharmaceutical company. These studies were happening at universities across Europe. These studies were happening in a lot of different places. These were the only folks who took the time to actually write them up, though. So this is they did not set out to investigate the effects of the implants, but nevertheless they were finding these cancers in the animals. One of the other, this one I thought was amazing. Someone said that, or I think it was Scott Silverman or someone from the Verichip Corporation saying that the fibrosarcomas that were found were benign. That would mean non-cancerous, and that's just utterly nonsense. All right, one of the other questions, haven't there been studies where chipped animals did not develop cancer? And as I said, I went through the literature. I went through PubMed, and I went through all of the articles referenced in sort of the starting set of articles that I had found. And we did find 3 articles which have been widely cited by the RFID industry as evidence that these microchip implants are safe. Back in 1990, Rao and Edmondson did a study where they took a number of mice, implanted them with microchips, and did not see really any result or any reaction in those animals. If you take a look, though, at the numbers that they were looking at, 10 mice over 3 months, 10 mice over 15 months, 74 mice over 2 years, this really doesn't compare to, let's see if I can get to it, to the studies where cancer was found, where you're looking at 1,200 animals, 1,040 animals, 177, 800, 4,200, and 2,000 animals. So going back, these other studies where they implanted the microchips into dogs, literally looking at 2 dogs for 3 days, looking at only one dog for 6 years. Given that this is only likely to happen in about 1% of animals, you really would need a much larger sample size in order to see any kind of an effect. We also found that typically these cancers were occurring in the second half of the animal's lifetime. So in the case of a mouse, that would be in the second year of its life. So if you're only looking for a couple of months or 6 months, you're not going to find the cancers. All right, this gets us to the question of the safety of the human implant. Was the FDA aware of this research when they approved the implantable microchip? And everything I've been able to piece together, short of having my FOIA request responded to by the FDA, strongly indicates that they were not aware of this information. The FDA has confirmed that when they approved the Verichip device, that they relied solely on the Verichip Corporation to provide evidence of the device's safety. I'm sure that was very interesting. So the FDA approval panel did not do any independent research. They did not look up or go onto PubMed or do any of the things that I did. They relied solely on a sheaf of documents that was provided to them by the Verichip Corporation as evidence of this device's safety. We know that once this story broke in 2007, that both the CEO and the senior medical officer of Verichip both emphatically denied having any knowledge whatsoever of any studies linking their product to cancer. So that would certainly indicate that if they weren't aware of those studies, they did not provide them to the FDA. Then right on the heels of that, when the Verichip Corporation was pressed a little bit further on this, they said, oh, well, we knew about the studies, but we decided not to include them in our sheaf of documents provided to the FDA because they weren't relevant. The one they specifically talked about was the Blanchard study. That's the one with the P53 mice, which I believe is probably the most relevant of the studies because it shows that these things are genotoxic. And they specifically said that they did not give that information to the FDA, that they withheld that from the FDA because it wasn't relevant because they were genetically modified mice. By the way, if you actually read that Blanchard study, it makes reference to Keith Johnson's study as well, which also found cancer in the microchips, or in the microchips were causing cancer. So if they had that one, they had the other one, and that should have probably cascaded them into finding the same information that I did. But we don't believe that that information was ever given to the FDA. All right. So that's a little bit of background. Are there any questions on the implantable microchips and the cancer research before I go on to the second part? Yeah.
In the states that the federal government in the states requires animals that have RFID implants in national program regulated by the Department of Agriculture. Have you done any investigation into findings with the farm industry, the farm lobby, with respect to what you're claiming to be clear evidence of cancer caused by these implants?
Yeah, one of the things that I'm going to be getting to here in just a moment is some of the regulatory issues that we've been looking at. I would say here in this portion of the globe where you need to be concerned is New Zealand. New Zealand requires that every dog in the country, I believe they may have gotten an exemption for farm dogs, but every other dog in the country is required by law to be implanted with a microchip. And we're starting to see a rash of microchips causing cancer in dogs now, and I'll get to that in just a moment. In the United States, it's really region by region. And in fact, I believe that there is a state in Australia that is requiring mandatory microchips. I don't think it's New South Wales. I think it's one of your other states here. Yes, do you know where it is?
Oh, no.
Okay, hang on. So in the U.S., there are certain cities, like unincorporated areas of Los Angeles County. The County Board of Supervisors has passed a law requiring all animals over 4 months of age to be implanted with a microchip. So as far as the program that you're talking about, the USDA, the Department of Agriculture's federal farm animal registration program, that actually does not require microchip implants. It requires, and by the way, it's not even being implemented because there's been a lot of backlash. That's sort of on the table being discussed right now. But that requires that all animals be uniquely numbered and that number be provided to the federal government. How a particular farm or farmer chooses to number the animals under their care is up to them, though. So a lot of them are using RFID ear tags, which are plastic tags that hang down, and the RFID component is below it. It's kind of like an earring on a cow. That's a much more likely candidate than an injectable microchip. Yes?
Are any studies being conducted in terms of if there's some systematic difference between the animals that get cancer and those that don't?
Well, given that I would love to see more studies on this, to answer your question. What's interesting about this is that these animals are almost genetically similar. They're almost genetically identical because of the way that they're bred for use in laboratory research. So if you have a group of 1,000 animals and 1 or 10% of them is developing cancer, presumably those animals are very genetically similar to their brethren. And so the real question comes up, what is it that's causing these cancers across the board? Would they have developed in the other animals over a longer period of time? Is there something different? We don't know that, but we do know that they're living in the same cages, they're eating the same food, they're drinking the same water, they have the same environmental exposures, they're the same age. So, what makes one of them get cancer and not another one is a question they've been asking for years about other kinds of cancer research as well. You give animals saccharin, some of them get cancer, some don't. All right, yeah.
You categorize the United States RFID as a drug. It's a medical device, right?
It's a medical device.
Okay, and the second question is the agency in charge of that the same for drugs or for medical devices?
It's the same agency. The Food and Drug Administration, the US FDA, has a division that deals with medical devices and another division that deals with drugs. Yeah.
And you don't have to make medical trials before giving it free for the public in the United States.
You do for drugs, but for medical devices, you don't. So
This is a medical device.
This is a medical device, yes. It's a Class 2 medical device. That's how it's been classified under the FDA regulations. Okay, so now let me talk a little bit. I've been an activist working on issues of privacy and databases and the like since 1999. When I was a graduate student at Harvard, I actually became frustrated at the supermarket frequent shopper cards that were making a record of my purchases, and that launched me on a whole career of working on privacy issues and technology. When I stumbled across the RFID industry back in 2002, I was horrified at the pains that I discovered that this industry was involved in, and I'll talk about a little bit of our advocacy work on the RFID industry and the implants. All right, one of the things that's been coming up for me recently, and in fact next month, we're about to launch a brand new initiative called chipmenot.com. If you read to the end of my 52-page microchipping article and now the 12-page version that's going to be published by IEEE, you'll find that we have a series of recommendations there. One of them is that we do need further study, as you pointed out, to try to understand why these animals are getting cancer. We have recommendations for veterinarians and pet owners as well, that if you have an animal that has been microchipped, you want to regularly pet that animal and sort of feel for any lumps, tenderness, heat, swelling, anything that might indicate something unusual. If you do find that, you need to go to your veterinarian immediately. In the cases where the microchips caused cancer and it was found by the pet's owners, not by the veterinarians. And in some cases, they even came back with normal lab results, but there was a malignancy forming around the chip. So we've got a whole series of recommendations. The one that I think is most important, and I'd like to see this established worldwide, is a registry for adverse reactions. Now, we have that for human implants. So if people implanted with the Verichip under FDA regulations were to develop problems from it, there would be a formal procedure for reporting that. But in the case of animal health, there is no such registry. So you could have an animal device that's causing huge problems in animals, and the company, even being aware of it and receiving numerous phone calls and numerous veterinary reports, would have no obligation at all to report it to anyone. So we'd actually like to see that change, that devices that are impacting animal health probably should have a requirement that there be some reporting. What we're doing in light of the fact that that doesn't exist is we're actually creating a registry on the internet for anyone to report to. And we're going to break that down into reports that have been peer-reviewed and published in academic journals versus reports that have been validated and substantiated by a veterinarian or a pathologist versus simply anecdotal reports from the public. So we'll have 3 different levels of reporting on there. We're doing this in response to a number of people who've contacted me personally saying, my dog just died with an enormous tumor. This dog that you see on the left is a bull mastiff named Seamus, and Seamus just died a couple of months ago with a 4.3-pound tumor surrounding 2 microchips that he had been implanted with. His owner did not know that the breeder had already put a chip in him. He was walking past one of these free, microchip your dog for free today booths, had a second chip put in him, and within about a year, Seamus had developed a tumor that grew and finally took his life. The dog that you see on the right is Scotty. He is a terrier who just died last week, and his owner, Linda Hawkins, is beside herself. She had him microchipped, and he developed a tumor around the chip and required extensive surgery. He's been on chemotherapy for the last 6 months, and he finally passed away last week. There is, if you look on the internet, you can simply do a search in the dog forums, and you'll see whenever this topic comes up, inevitably someone in the comments will say, what do you know, my dog had a cancer on its neck, and when they removed it, there was a chip in it. So we're seeing this over and over, and yet there's no public process for any kind of clearinghouse for this information. So we're creating that. We're actually looking to put together an advisory board of experts who would like to work with us. So if anyone in this room would like to work with us in an advisory capacity, we'd love to talk to you. But that should be launched sometime within the next 6 weeks. We've already done all of the programming for a form where people can log on and put in the information and upload information about their animals. Some of the other things we've done, as I said, I worked for about 6 months with Todd Lewin with the Associated Press to get the story out about the implanted microchips causing cancer back in 2007. That story was reported all over the world. I wish it had had more of an impact on stopping some of these mandatory dog chipping regulations that still seem to be moving full force. But what it did do was stop this. They were implanting Alzheimer's patients at a place called the Alzheimer's Community Care Center in West Palm Beach, Florida. They had 200 of these people lined up ready to be implanted. And here's the problem. The Verichip Corporation, which is now the Positive ID Corporation, they're selling a product that no one wants to buy. The company has steadily lost money. I think the last year they reported income, they earned less than $2,000 total for the entire year off of their chipping operations of humans. So nobody wants their product, and they keep kind of trying to find these captive populations that they can chip. They were able to get an Alzheimer's daycare center to agree to microchip these folks. As a human sciences researcher myself, I was horrified that there was no institutional review board, there was no ethics panel, there was no review whatsoever as to the ethics of implanting, as part of our research study is what they called it, implanting people whose mental impairment meant that they couldn't give informed consent. So not only were they crossing a serious ethical boundary in terms of using Alzheimer's patients as their guinea pigs, but there was no oversight whatsoever of this trial. And it was featured on Good Morning America, breathless reports about it. So we protested. I headed down to Florida, and a group of Caspian members and I got together outside of the Alzheimer's Community Care Center, and we said, you need to stop. You shouldn't be doing this. And that was right about the time that the cancer story was about to break, so I knew that was going to happen right on the heels of this event. And as a result of that, Blue Cross Blue Shield canceled its trials. They were doing voluntary medical trials with patients to see if diabetics and others would benefit from having a microchip that could be scanned in the event they were unconscious, that would link to their medical records. I was contacted by one woman who was actually part of that trial, who contacted me to say that she had had her microchip implant removed, that it was a painful process. She sent me a photograph of her arm, which was black and blue from here to here and swollen, because the process of getting these back out of your body is actually extremely invasive. They form, as you can see here, they form a capsule of tissue that that will biobond, really does bond to the body, and it's difficult to cut that back off again. So I've heard Scott Silverman of Verichip refer to this as a reverse injection procedure. Nothing could be further from the truth. And this is when they gratified me. Just before our protest in Florida, and just before the story broke, Verichip, because of its coverage on Good Morning America, because of its chipping of the Alzheimer's patients, had managed to inflate their stock up to over $11 a share. And after the cancer stories broke and all the studies were quietly canceled and people were getting their microchips removed, we saw them tank. And in fact, they were on the verge of being delisted from the stock exchange and becoming a penny stock. This seems to happen to this company periodically over and over, but it was gratifying to see it happen then. All right, and now finally, I'd just like to give you a sense of why I have devoted 8 years of my life to working on the issue of RFID, and that is because there are some really horrifying plans afoot for what the powers that be would like to do with us once we become microchipped. And whether that is microchipped with an implant, whether that is microchipped with an ID card, whether that's microchipped with a chip in your shoe, the plans are out there, and they're very disturbing. So I'd like to share those with you. If you'd like to learn more about this, you can read our book Spy Chips, which, even though it was published in 2006, is probably more timely today than it was then. It was a book about 5 years ahead of its time. All of the things that we reported on in that book are happening in lockstep, one after another. It is like a roadmap to the future.